Hi everyone. Sorry about the blurriness. I'm having to use my dang, my well, call me Grace. I'm having to use my computer webcam instead of my HD camera. Um, Long story. So, and excuse the whole breakout. I feel like a teenager. Um, so yeah. Trying to conceive update. I am 10 DPO, and it's going to take me just a minute to explain. I took a pregnancy test yesterday morning, and it was so very faint positive on a first response early result, and I posted it on Cafe Mom, and of course everybody's like, oh, I don't see anything, and then half of them are like, oh, I do see something. So that drove me batshit crazy. Anybody who is trying to conceive and you hear somebody say, yeah, I think I see it too, yeah, that's horrible encouragement for somebody who's peed on a stick obsessively. So anyway, um, yeah. So I went to the store yesterday morning at like freaking, no, back up. So I kept testing all that day and it kept coming up positive. So I called my OB and told her that I was getting positive on a pregnancy test, at home pregnancy test. And they were very light, but they were there. I wasn't making them up. So she called in a blood order work for me, which she did they count and not just a quantive, or I'm sorry, not just she did a serum, not just, yes or no. She did an actual count. And my count was 4.8, and anything under 5 is negative. So she was like, no, I'm sorry, you got a batch of bad tests. Fuck. Okay. Had my hopes up, whatever. So this morning, I get up and because I'm a piano stickaholic, I didn't care that I had just had a blood test. So I took a internet GP, the Wandufu, Wandaf, I don't know how the hell to pronounce it. You know what I'm talking about if you're trying to conceive them little bitty strips. So I took one, and it was like 3 o'clock this morning, and a line shut up, and I was like, it's not possible. I just had a blood test. So this is when I ran out. I ran out this morning at 3:13 a.m. to Walmart and picked up a 2-pack of digitals, a 3-pack of first response early results, and a 3-pack of answer. So I was like, you know what? If all of these are positive, something is wrong with me because, certain things other than pregnancy can cause a positive pregnancy test, one being certain forms of cervical cancer. So it really had me concerned because, as some of you know, I have lupus. So I have an autoimmune disease, which makes me more susceptible to getting sick and stuff like that. So I didn't want to, wait to the later stages to catch it. So I called my OB. No, that's a lie. It was like 4:30, and I was playing on my phone, chatting the Cafe Mom girls, and I couldn't go back to sleep. And I was like, you know what? I'm just going to go to the ER. I'm just going to tell them that I have a history of ectopics and that I'm scared and I need blood draw. And yes, it was a lie that I thought I had an ectopic, but knowing from working in the medical field that that's an immediate blood draw and usually an ultrasound. So the doctor was like, yeah, no problem, whatever. Because I was like the only person in there, so he didn't even care. So I felt kind of bad about the then because he wouldn't even care to do it. But so I was in there for an hour, the whole time, of course, talking to my Rose and Erica and Anna and Lori and Kayla and everybody. And, they were giving me awesome support with, it's okay. Either way, it's fine. It's what God has planned for you, which is awesome. But, of course, we all know we want to hear, like, shut up, bitch. I want it to be bothered. So, about an hour passed by, and I'm sitting in the emergency room, and the doctor comes in with a piece of paper in his hand. He sets it down. He's like, I need to know these brands of pregnancy tests that you're using. And I was like, well, it's like the Internet Cheapy Wandufu thingies and a first response early result and an answer. And he was like, he has never in his life seen a home pregnancy test pick up such a low HCG. So my HCG was 9.7. And that meant that I'm pregnant. So, after all we've been through the last 2 years of 3 losses and then losing our daughter, and then, my husband losing all of his sperm because of testosterone therapy, and then for that to come back after getting medication, and for my bicornuate uterus to have had surgery on it, and for it to have heal time, it is a blessing beyond blessings that this creature that is living inside of me is in existence right now. I did not, however, get an ultrasound, so being that it was 9.7, he said we wouldn't even see a gestational sac because there was not even a point, and we couldn't even tell if it was ectopic, even if it was, because they're not big enough to see within the tubes to see if that's actually where they're at. So I'm thinking all the time, whatever. And he told me, don't stress the ectopic thing at all until you're at least 6 or 7 weeks, and I'm only 3. So, I want to see my OB before then. So anyway, so I called my OB. I'm trying to make this short. I'm at 6 minutes. I called my OB right after I got out of the ER and was like, I know y'all did a blood test yesterday, but I'm pregnant. And the reason I need to call my OB is because I have low progesterone production and a blood clotting disorder because of my lupus. And so that means I need progesterone and Lovenox and ASAP. And I've never caught a pregnancy this early before, so I was hoping that we could go ahead and get started on those medications to maybe help boost the probability of keeping a hold of this little sticky bean. So she immediately called in my Lovenox, of course, and I went and got it. Well, I had a leftover bottle that was still snapped and sealed with my progesterone oil, and I went ahead and I took a shot because I assumed she was calling me a script because, I've seen her for 7 years, and she always calls me a script with progesterone shot. Well, this time she said my progesterone looked good and she went and do it, and I was like, and this is her nurse, not my doctor, but I was like, but I took the progesterone shot, so it's going to make it look good. And she's like, well, I'll let her know. And they call me back, and she's like, no, she said she wants to wait till 9 days to redo your blood work, and we'll see what your progesterone levels are then. So, whatever. So I'm having my blood work done Monday, and when they call with the results, I'm just going to tell them, no, for my own sanity, I know this is crazy, but I just want to take the shots because I know they work because I had a son because of them. I had lost 4 before him, took the shots with him, lost 3 after him without taking the shots, so obviously it's doing something. So anyway, so that's where we were at. And she was like, well, I don't even have the results from the emergency room yet. And I was like, well, I can bring them to you. And she's like, don't worry about it. I'll just have them fax it. Well, like 2 hours later, she calls me and was like, I still don't have the fax. And I was like, well, I'll just bring it to you. And she said, don't worry about it. Just go down to the clinic and have them draw your blood. And we'll just do a recount. She's like, it won't be any different than this morning because, you just found out that you're pregnant with 9.7, so it's not going to move at all within the next 24 hours. So she calls me like 2.5 hours later, and she's like, your blood work's in. And I was like, okay. And I was hoping she was going to say, like, it's 9.7 or 9.9, and not like 5.4, because, like, oh my God, it's going down. But she called and she was like, your HCG is already up to 14.7, so you have almost doubled today within a 12-hour or 4-hour period. She's like, so that looks good. I was like, awesome. So, the nurse said that. I haven't talked to her, my actual doctor yet, which I'm going to demand that I do Monday. So anyway, long story short, I am 3 weeks and 3 days today. I'm going to be making update videos every week on Tuesdays, and today's Friday. And the reason Friday the 27th of 2012 is when I found out, just in case I ever need a record of that. I know it puts the date at the bottom, but I always like to say it. Since I'm 3 weeks and 3 days, I don't want to have to do updates every 7 days from today and say, I'm 4 weeks and 3 days, and 5 weeks and 3 days, and 6 weeks and 3 days. I just want to say so many weeks, so many weeks, so many weeks. So we're going to start on week 4, which will be Tuesday, which is when I make my updates, every Tuesday. And I'm going to go over like symptoms and feelings and emotions and cravings and weight and exercise and everything that I do this whole pregnancy. Because there's a couple things that I did with Suki that have always been in the back of my mind, like, oh my God, could that have possibly caused it? Which I think every woman who's had a loss has been there and thought, did I do this? Which logically, probably not, unless you're like getting hit with the stomach with a baseball bat or jumping on a trampoline. And even jumping on a trampoline, is not going to usually cause a miscarriage. But you know, like I would always type with the computer on my lap. So I thought, well, fuck, what if like the radiation from the computer messed with her or something? Unlikely, but this time I'm keeping the computer away from my stomach. Um, I took a lot of Tylenol when I was pregnant with her, especially at the beginning, because of all the early pregnancy cramping, and it helped me to block it out of my mind when it wasn't there. But I'm going to not do that this time. Also, I ate a lot of Tums with her, so it's something I'm going to have to like do it, you know, not eat as well. But I haven't had an issue with eating Tums because my diet changed where I'm eating leaner and cleaner. I'm not eating the greasy, junky, fat food processed crap, so this acid reflux really has gone away. So yeah, I'm going to do updates. I know I'm talking 1,000 miles a minute, and I'm so sorry, but um, um, it's almost 11 minutes, so I'm trying to hurry. So here is my digital. Hopefully we'll be able to see that. It says pregnant. So I actually have the words. I'm going out tomorrow and to buy my scrapbook. I always scrapbook my pregnancies, even if they're a loss, because it's something that I will always have. I'll have the pregnancy test. I'll have the memories. I'll have any ultrasounds that I get, just to keep a record that this life existed, no matter how short or brief this life is, or long. I want records of it. I have records of my son. I have records of Suki. I have records of Nathan. All of my losses, except Gavin. He's my son. He's 4. I have records of them all. I have photos, 40 photos of Suki that I don't know what I would have done without those. Thought of not having those, of seeing her inside of me, is just heartbreaking. And then, of course, I had videos or pictures taken of her after her birth. But, you know, to see those moments captured where she was alive and kicking, and I have video of it, it's just amazing to me. So I'm going to start my scrapbook tomorrow. So, final word. I am 3 weeks and 3 days pregnant. I can't believe I can say that. Pregnant today. Sorry, I was going to say it's going to hold it together. I'm pregnant. And I thank you, everyone at Cafe Mom, who has stood beside me the last 2 years and went with it through me with Suki, and I went through it with me with my husband losing his sperm and my surgery, and you know, being on Clomid, which I wasn't this cycle, but being on Clomid and taking all those Oradril shots and feeling like crap. And you guys are amazing, especially my Trying to Conceive Miracle girls. There is not a better group on Cafe Mom. We might be small, but we are family. So if you are ever thinking of trying to conceive, make sure you go to that group. I'll post a link below to the group. It's an amazing group. I'll stay part of it probably for the rest of my life, just to keep in contact with some of the girls there, and half the girls will have their cell phone numbers because we're just that close. So yeah, that's where I'm at. I love you guys. Thank you.